Did you know that almost half of small businesses right here in Central Texas cannot afford health insurance for its employees? But something's being done about that, and we will tell you coming up.
At 6:34, many small businesses are struggling to pay for health insurance for their workers, and now one group is working to help Austin employees get insurance. Kate Whitehaw is live this morning with the details. Kate, good morning.
Good morning, Chris. Well, as more small businesses open up, fewer and fewer employers are able to offer their employees health insurance. And the number one reason for that is cost. During this past legislative session, lawmakers passed a bill to provide regional health care programs. And now that process is starting. What looks like trash day is actually a booming business called Junk Busters.
We are a professional junk removal service. We're based here in Austin, and we go out and haul away unwanted items from homes and businesses.
Steve Wallhausen started the business here in Austin back in 2004, and it's grown to have 8 employees.
Just be sure that we set the donatables aside.
And while someone else's junk has become his treasure financially, health insurance for his employees is falling to the bottom of the heap.
We were looking at rates roughly about $300 a month. By Texas law, we're required to pay at least half of that. So $150 for the employee, $150 for the company. You'd multiply that out, let's say 10 or 15 employees, it starts to stack up pretty quick.
In this region, in Central Texas, 40% of small businesses can't afford health insurance for their employees.
That's why the Indigent Care Collaboration has put together this survey for small business owners to fill out.
So this is a chance for small businesses to fill out a survey and tell the community what they need in health insurance.
Like how much they're willing to pay. Steve has his own solution.
And if they could establish some kind of just basic health care system that would allow them to affordably go to a doctor, get some medicine at a comparable rate, say $20 for the copay, $20 for some antibiotics, it would make a huge improvement over what we've got now.
And on a side note, Steve has looked at health insurance several times for his employees. When he presents them the option of how much it's going to cost, the employees say, you know what? We'd rather put food on our table than have to pay for that health insurance. Now, if you're a small business employer and you would like to fill out that survey, we have a link set up on our website at kxan.com. That survey will be active until this Friday. The results should be back in sometime in October, and what they plan to do with these results is still a little bit unclear. The collaboration said they plan on forming some focus groups, but as far as the long-term effects, they didn't really have a plan to tell me about.
And what kind of small business can fill this out, Kate? Any requirements?
No, actually, just click on that link and you go right to it. It doesn't ask, you could be, you don't even have to be a small business, I guess, owner.
They want to know what everybody
They're just
thinks.
hoping you are, I guess.
Okay, that works. Hey, Kate, thanks for that update. We appreciate it. And as you said, that link will stay on our website until Friday.
Is there a way for small business owners to provide health insurance to their employees without going broke? Our Kate Whitehaw is live following this story. Kate, good morning.
Good morning, Chris. Well, we always hear about the good news of more and more small businesses starting up here in Central Texas. But the problem is they can't afford to provide health insurance for their employees. And of course, the cost is just sky high. But now something is being done about it. We are going to tell you all about that coming up in just a few minutes.
All right. Thanks a lot, Kate. We appreciate it. Well, did you know that 40% of small businesses right here in Central Texas cannot afford health insurance for its employees? Well, now something's being done about that. Kate Whitehaw is live in South Austin to tell us what it is. Good morning, Kate.
Good morning, Tanya. Well, we've all seen more and more small businesses opening up shop here in Central Texas, but the one thing they cannot provide their employees is health insurance, and the reason for that is the cost. Now, a perfect example is Steve Wallhausen. He started a professional junk removal business here in Austin called Junk Busters back in 2004. While business has been great and his staff has grown to 8 employees, there still is not enough revenue to afford health insurance. And since Steve's story is like so many other business owners, the group called Indigent Care Collaboration is asking business owners to fill out this online survey. The goal is to come up with an affordable alternative to traditional health insurance.
So this is a chance for small businesses to fill out a survey and tell the community what they need in health insurance.
And if they could establish some kind of just basic health care system that would allow them to affordably go to a doctor, get some medicine at a comparable rate, say $20 for the copay, $20 for some antibiotics, it would make a huge improvement over what we've got now.
Now, that survey for small business owners to fill out is on our website at kxan.com. You can find a link. It's going to be active through Friday. They expect to have the results back sometime in October. Then what they plan to do with the results is still a little bit unclear. They're planning on setting up some focus groups and down the road maybe figure out a way to develop a different health insurance.
All right, Kate White live for us downtown. Thanks, Kate.